Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily.
And my name is David. And today, we will be interviewing Dr. Ellen Hillegass. She received her doctorate in exercise physiology from the University of Georgia. She is the CEO and president of PT Cardiopulmonary Educators. She is also former chair of the Clinical Practice Guidelines Revision Committee on Venous Thromboembolism for APTA and was the past chair of the Oxygen Recommendations Task Force for APTA. She received the highest APTA honor, which is the Catherine Worthingham Fellow of APTA. She is also a board-certified cardiopulmonary clinical specialist. Welcome, Dr. Hillegass, and thank you so much for joining us here on the podcast today.
Thank you for inviting me.
Of course. Thank you for coming. So let's start off with a heavy hitter question. Why did you start and go into physical therapy?
Oh, doesn't everybody say because they want to help people? I have to tell you, that question made me think because I remember I just wanted to be in the medical field, but I didn't want to be a nurse cleaning bedpans. And I really didn't want to do all the years for a physician. So I researched all these others, and I shadowed a physical therapist who did in-home and hospital care, and he was just amazing. And all his patients loved him. And I think it was after shadowing him, I just decided, okay, this is what I want to do.
That's awesome. It's nice where everything really does start with shadowing at times. You just have to put yourself out there, and you never know what you are going to experience when you do that time.
Yeah, so to take that even one step further, then when did your love for cardiopulmonary really begin and what led you in that direction?
Another good question. So way back when I went to school, we've got little bit in cardio. There was not a course. It was basically how to take a heart rate and a blood pressure and how to listen to lungs. And I was in the clinic, and in my first clinical job, we rotated every 3 months to different divisions. And I started out, in rehab, acute rehab, and I rotated, to regular acute. Then I rotated to the pulmonary side, and I had no idea what I was doing. And the next rotation was to cardiac, and I really was overwhelmed. So I went and took a continuing ed course, and it just sent fireworks off. I mean, it was like, I love this stuff. I want to learn more. So I applied. At that time, we did not have any doctoral programs. So, and I already had my entry-level PT. So I went and got a master's in cardiopulmonary physiology. I moved to Atlanta to get my degree at Emory. And so then I went to clinical practice. And so I was doing cardiopulmonary from as soon as I got out of Emory, and really haven't stopped since then.
That's great. So then with all of that, when did you decide to author a textbook?
Oh, I was approached by, it was not Elsevier at the time. It was another company that got bought out by Elsevier. And they said, I was one of the very first cardiopulmonary specialists. I was not the first three, but I was the next year. And so they had gotten my name, and they asked if I would do a textbook. And I absolutely hated the textbook that was out. I couldn't use it. I was part-time teaching, and I couldn't use it. It was not usable for teaching. And so when they approached me, I thought, okay. So I took the project on with another individual. And then after the second edition, I kind of just took it all over because he couldn't keep up and didn't want to keep up. So I took it all over to myself for the third edition. But if they hadn't approached me, I wouldn't have thought of doing it. But I really did hate the book that they were using. It just wasn't usable.
Now,
So
was this your first experience with being the author of a textbook or being involved in writing to this degree?
Well, I'd written a chapter or two for some different books, but
Hmm.
no, I'd never taken on a project like this. I really had no idea what I got into, and I still don't know. Every time I write a revision, I still don't know why I do it.
so now each edition that does come out, what usually change? What do you go in as an author and look to adjust as a new edition does get released? What are you looking for?
um, what's the latest? So in this edition, we did a whole chapter on women and heart disease because that was missing. I mean, that was maybe paragraphs, but it's much bigger now. And then there's certain ones that were just too overdone, too much reading. And students don't read anymore. So you had to put much more pictures in and cut out the reading. And so I try to each time add lots more figures and tables and things, um, and cut out some of the extra stuff that they don't need. So I go through the chapters and I say, what's a need to know
Hmm.
and what isn't necessary to be in this text. And I think, I added a second new chapter, and that was pulmonary hypertension, because now where it existed, but we never saw it before because we never looked for it, we now know so much more about it. And people don't know what it is and how it affects their patients. And so I wrote a chapter on that because I do a lot of continuing ed on that.
Hmm.
And so that's in there. But yeah, most of it, I'm just trying to spruce it up with figures and tables and the latest information.
Yes, something I would love to go back and highlight that you just mentioned, which I think our listeners, who are primarily students, will really benefit from hearing again, is the importance of you going back and making those necessary changes and updates to really help students learn more efficiently. Make sure you're highlighting the key information and you are aware that maybe, the longer textbook approach of long paragraphs isn't as beneficial at this stage. Students are more benefiting from figures, pictures, graphs, and you're making those necessary updates, which I think is so beneficial for our students. So thank you for listening to people's feedbacks and growing with, the students.
Well, let me give you a little bit of input from the publishers. They still want to put out books. And I think we need more interactive, but it's
Hmm.
very difficult. They won't listen to us.
Yeah.
I've been begging for, this is the second edition, the fourth and the fifth. I begged to have much more interactive. Oh, yeah, we'll do that. Nope. And that's what the students need, something more interactive.
For sure. I know I personally benefit more from that interactive aspect as opposed to just the reading more so. So
Yeah, I
I know
think
that's
it
something
really
you benefit.
helps. It really helps promote active learning and active listening instead of just passive learning, highlighting a sentence and not actually challenging yourself to retain that information. So hopefully some steps are moved in that direction in the near future. We can hope. Now, tell us about PT cardiopulmonary educators and how did you get started with this?
Well, I started a residency program, and there were only 5 or 4 in the country when I started mine at Mercer. And it's not mine, but I started. But sounds very possessive when I say mine. But I started the Mercer program, and we only took 1 or 2 students. So how do you take all the time to teach all this information year after year with each 1 or 2 students? So I said, we need to develop some webinars that we use to teach, and we have a whole system of webinars that they can take and learn that way. And then we can follow up with the clinical aspect with taking cases related to, coronary disease or pulmonary hypertension. And so they get the didactic from the webinars. So that's where I started. And then what happened was a lot of people who were sitting for the CCS exam, the advanced boards, they wanted to take these webinars, but they wanted more advanced ones. So I developed those. And then I just kept developing continuing ed webinars. I'd do them and record them, and then people would want to have them later on because they didn't have a chance to come to the course. So it's grown that way to the point that I now even have a core curriculum for programs that don't have an educator to teach the cardio. They can take the webinars and they can take someone to be a facilitator and still get the basic education they need instead of, really sacrificing with, a poor quality cardio course. So it just grew out of a need for cardiopulmonary education because there's not a lot of people doing cardiopulmonary education. It's growing, but it's still small compared to ortho and neuro and peds.
Yes, and with that growth and everything, I think that you kind of answered it, but there may be something else. What is one thing that you feel could be done to make the physical therapy profession better?
Well, my current my current activity is to see that we are designated by CSM and other carriers, other healthcare insurance, as if we're a specialty or specialized, that we're designated as advanced providers. We are losing out left and right to people going into PA and NP. And it's because they're a step above us. And we have just as much, if not more knowledge in a lot of areas, but we're not seen as an advanced provider. And we should be designated as an advanced provider. And in the field of cardiopulmonary, that would mean that we could be supervising the cardiac rehab instead of a PA or an NP, and other things that we could be doing. And in the other fields, orthopedics and neuro, an advanced provider would have a lot more respect and autonomy and authority. And I just think that that's the next step we need to take. The other thing is I think we need to have much more PR about what PT is. And people still don't know what we do. They still don't know our value. So those are two things. For specialization, we need to be designated as advanced providers. And for the regulars, we need to be acknowledged for our value. For example, look at what just happened. The CEO who was just murdered by a person who had what? Chronic back pain. Mm-hmm. Is there anything in his history that he's actually even gone for therapy, or did he just have surgery? Back pain is one of the biggest problems we have out there. And people think surgery is always the answer. Now, I don't know his history. I don't know anything. I mean, maybe he went to a lot of therapy and then he went to surgery. I have no idea. But too often, surgery is the answer. Yeah. And it may not really be it. So we need to be seen for our value.
Yeah, we don't just give massages to people, as many relatives
walk them with a walker.
Yeah, walk them with the walker through the hallways and everything. We do a lot more than that, and there's a lot of preventative things that we can help out there as well. So advocacy is key.
I think across the board, you just mentioned it's so important for us to advocate for our profession on multiple platforms. Advocate with the general public to help expand their knowledge to understand how we can be utilized in their day-to-day life, but then also advocate to other providers, insurance companies, other specialties within the healthcare field to also expand our skill set in that avenue as well. So across the board, we just need to advocate. And I feel like we need more people to be a part in that advocation. It can't just be, the same few people high up in the PT field or at CSM. It needs to be everyone across the board.
We need to be involved with other organizations and show them our value. I have been, and they're just amazed. Like, you can do that as a PT? And you're like, yeah, it's nothing magical. But there's so much stuff, and there's so much research coming out about activity and the importance of activity. And when you look at that, who are the ones who get people moving to do the activity? That's us.
True.
So one more piece of advice we're curious about. What is one piece of advice now that you would give specifically to PT or PTA students?
I would find a mentor. So PTAs can find a PT or a PTA as a mentor. PTs should be finding a PT or even someone else as their mentor. I've had great mentors that were outside of the PT field. But in order for you to grow, you need some help. And it may just be an ear who listens to you and maybe gives you some suggestions, or they may show you how to do things, or they may lead you to research articles, or they may be there for your personal needs just to, hey, I'm having a bad week. Or, one of my colleagues, she had to have emergency surgery and she's thrown back into all this stuff, and just to be an ear, and support. So you really need to find somebody. It doesn't have to be in the PT field, but you need to find somebody. You email them, you talk to them at a meeting, and you ask them, would you mind if I contact you from time to time to ask you questions or have you give me some guidance? And it's hard to make that first move, but once you do, it's so valuable. It really is. And you can have multiple mentors. I'm not saying you have just one, but I think the way you will grow as a PT or a PTA is you need to find somebody who will help you, who you can bounce things off of, who can share things with you, etc.
And don't be scared or afraid to reach out to that person either, because you never know who will be that mentor and step up and be open to that unless you try.
Truly.
Yeah. So it is time for a fun question, a surprise question. We have one built in for every guest. So your question, you got Chipper Jones, Greg Maddux, and so many more of your former members of the Atlanta Braves. Who is your favorite baseball player of all time and why?
Oh, gosh. Well, you named some.
I'm sure.
You named some because I've watched the Braves forever and ever. I actually have to tell you, it's between probably Maddox or actually Dale Murphy from way long ago.
Okay.
Both are highly respected individuals, have great records, were great family men, as far as that goes, and great contributors here in Atlanta to things. And so they've left legacies here. And I've gone to World Series. I've gone to lots of different things that the Braves have been in. We've gone to parades. My husband has been to Cooperstown when four of the Braves got into the Hall of Fame. So, I mean, we're definitely Braves fans, but I think it's not just their skills, but what they do in the community and how they are with their families. And that's really important to me, is a balance between all of that.
That's huge, and I love those reasons as to why they are your favorite players. I think, I'm not sure if you're aware of this, one of the biggest just jabs, obviously we've spoken about this before, I'm a Mets fan, and one of the biggest jabs I feel like that could ever be done to the Mets overall is your beloved Chipper Jones named his son Shea.
Shea.
Yeah, after Shea Stadium, where he was such a phenomenal hitter. So I think that's always a fun fact.
Well, and one of our former ones, what's his face? Recently, he's not of Mets. Who did he go to?
Freeman?
Huh?
Freeman?
Yes, Freddie. I mean, again, another example. Just another example. We missed him, but you have to go and make the money while you're young. And so it's it wasn't really against the Braves in that sense. You kind of have to do the things you have to do. But another great family man has done so much. They do so much for the Children's Hospital here, all of them.
That's cool.
So you have to respect that, not just their skill, their high level skill, but
yeah, that's a very important caliber of a person, And it says a lot about them.
Yeah, we have a lot here in Atlanta that have done that. Not just sports. We have, well, Bernie Marcus just passed away, but they have supported so much in Atlanta. They made so much with Home Depot, the founders of Home Depot, and they have put it back into the community. It's just amazing what they have given to Atlanta. So that's where you have to really have a lot of respect for people when they do things like that.
100%.
So
That
how
was
can our
tough.
listeners
I
how
can
can our
answer that
listeners
easily.
I know. How can our listeners get in touch with you or find you on social media, on any websites? How can they reach out to you?
Well, I typically don't do a lot of those. I mean, I know you do, David, but I don't. I've never really had the time or the inkling. So it's via email or my website, as far as that goes, is the best way to get me. Because I don't do a lot of the social media. I'll look at some things on Instagram, but I don't, I look at some every once in a while on Facebook or X or, all these things, but it's not of my culture. It's you grew up with it. I didn't grow up with it.
I'm
So,
bad with social media. David's still yelling at me to get better on social media. It's a work in progress. But what is your website in case they want to look up your website?
so it's ptcardioed.com. And my email is then Z is in zebra, Hillegass, HILLEGASS @gmail. And I try and get back. If I don't get back to you right away, then you need to email me again because there's like all these emails in between. And I forget. I've been trying to catch up since I was away. And there's a couple I was like, oh, yeah.
I'm sure,
So
I'm sure.
I'm pretty bad about that.
Well, Dr. Hillegass, thank you so much for your time. It was a really great pleasure to have you on our podcast. Thank you so much.
Yes,
Well,
thank
thank
you
you
so
for
much.
inviting me. And you all have a great holiday.
Thank you, you too. Now that you heard our interview with Dr. Ellen Hillegass, here is a quote from Vince Lombardi. Winning is a habit. Watch your thoughts. They become your beliefs. Watch your beliefs. They become your words. Watch your words. They become your actions. Watch your actions. They become your habits. Watch your habits. They become your character. So keep on fighting for your dreams. Be true to yourself. Be true to your dream and chase this down and go get all of your goals because you can do this. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow. Thank you once again.